Welcome to SimplyRN. This video is for educational purposes only and not indicated for clinic use. Today's topic is ischemic stroke. Ischemic stroke is the most common type of stroke that accounts for 87% of all strokes. The most common cause of ischemic stroke is thrombosis, which is formation of clots in arteries within the brain. The most common cause of thrombosis is atherosclerosis, which is the buildup of fats, cholesterol, and other substances in and on the artery walls. This buildup is called plaque. Plaque causes stenosis, which is narrowing of the affected arteries. Plaques can rupture and attract clotting factors, resulting in thrombosis and decreased or a complete blockage of blood flow. Embolism is another cause of ischemic stroke. Embolism refers to a clot that is formed somewhere else in the body and breaks off and travels to the brain and causes obstruction of blood flow. It is most commonly from a cardiac source such as atrial fibrillation, atrial flutter, or heart valve dysfunction. Emboli can lodge in arteries that are already narrowed and block blood flow. When blood flow to an area of the brain is interrupted, whether due to a thrombus or embolus, rapid death of brain cells occurs and an infarct forms. An infarct is an irreversible tissue death due to a complete blockage of blood flow. The central area of the infarct is known as the core and is considered irreversibly damaged. The penumbra is the area surrounding the core, which maintains some blood supply through collateral circulation, which are backup vessels that can provide alternative routes for blood flow. However, as swelling from the infarction grows, the penumbra diminishes, and the infarct core expands and increases the area of irreversible tissue death. The goal of acute stroke treatment is to salvage the penumbral tissue as much and as early as possible. That's what time is brain means. In my Stroke Basics video, we went over the BE-FAST acronym for stroke symptoms. Whenever a patient is having stroke-like symptoms, the priority is to always assess ABCs, airway, breathing, and circulation, and activate any emergency measures appropriately. The next priority is to call a code stroke in an acute care setting or 911 in outpatient settings. Because remember, time is brain. Perform stroke assessments such as using the NIHSS scale, as discussed in my Stroke Basics video, and find out when the last well-known time was. The last well-known refers to the time the patient was last known to be neurologically normal or at their baseline. This piece of information helps the stroke neurologist decide whether the patient qualifies for thrombolytics or clot-busting drugs. Another criteria for giving thrombolytics is to rule out brain hemorrhage by doing a STAT, non-contrast CT scan of the head. National guidelines call for door to CT time should be within 20 minutes, so when a code stroke is called, expect and prepare the patient for a CT scan. Other interventions that should be done at the time of stroke include checking blood sugar to rule out hypoglycemia, which can mimic stroke symptoms, ensuring adequate IV access. Obtain accurate weight for possible administration of thrombolytics, which are dosed based on weight, and check if the patient is on any anticoagulants. But all of these interventions should not delay the 20-minute window for door to CT scan. While a CT scan is primarily done to rule out brain hemorrhage, an MRI of the brain is the gold standard to diagnose acute ischemia. However, MRI is not used in the early acute phase due to the significant time needed to perform imaging, and also because it is not widely available. A CT angiogram can also be done to provide a map of blood vessels and to detect large vessel occlusion. Treatments for acute ischemic stroke include administration of IV thrombolytics to break down the clots. Examples include alteplase, or TPA, which can be given within 3 to 4.5 hours from last known well, and tenecteplase can be given within 4.5 hours. If the patient qualifies for thrombolytics, the goal is to administer the drug within 30 minutes from patient arrival. Another treatment for ischemic stroke is mechanical thrombectomy, which is a minimally invasive procedure that involves inserting a catheter to remove the clot, usually via the femoral artery, or more recently, the radial artery in the wrist. Mechanical thrombectomy can be done up to 24 hours from last known well, and it also applies to patients who may have already received thrombolytics. In the next video, I will discuss post-stroke nursing management. Thank you for watching. I will see you next time.